Hi everyone, my name is Megan Terrio and I am an occupational therapy assistant student at St. Catherine University. And today I'm going to walk you through doing a passive range of motion on my client Cassie. Now, passive range of motion offers many benefits for those who are unable to exercise for themselves. It helps to prevent muscle weakness and muscle stiffness for people who are confined to a wheelchair or on bed rest that aren't using their muscles all the time. It also helps to improve and increase upon circulation, as well as maintaining flexibility, which in turn decreases pain from muscle stiffness or spasticity. Passive range of motion is the motion of the joints with all muscular strength removed. Now what we want to keep in mind with the first range of motion is to keep soft hands throughout the entire movement. So the first one that we're going to go through is going to be the shoulder flexion and extension, and we're going to do all of the upper extremity motions. You want to make sure that your patient is always in a comfortable seated position, feet flat on the floor, and you want to make sure that there's no compensation during any of the motions, which means that they're not lifting up any body parts to compensate for any pain that they might be having. If you feel any restriction or pain, the motion should stop. First one we're going to do is shoulder flexion. So for this one, I'm going to support the full weight of the arm in my forearm. I have my first hand behind her elbow with the rest of her arm resting on my forearm. I'm going to have my non-dominant hand stabilize her scapula, and we're going to move into shoulder flexion. Shoulder flexion is up, all the way up, and then shoulder extensions all the way back to neutral, and then we're going to push the joint backwards. Extension. Doing okay? Feel any pain, you let me know. Flexion. Extension. All right, the next one that we're going to do is shoulder abduction and shoulder adduction. So the first one we're going to demonstrate is the abduction, which is away from the body. So this one we're going to lift. It should go all the way to 170 degrees. I'm going to support underneath the humerus and grab the wrists slightly with this hand. We're going to go all the way up, restricting when you feel some pain or any resistance. Adduction, and this is abduction. Adduction, making sure that the client's shoulders don't raise up and go crooked because they're compensating for any pain. The next one we're going to do is horizontal abduction and horizontal adduction. So I'm going to do straight out and out to 90 degrees. I'm going to grab this and support it just like I did for the shoulder flexion and extension. I'm going to support the scapula with my non-dominant hand, and we're going to go backwards for abduction. So abduction back and back to 90. Back. And then a deduction is going to be forwards across the body. A deduction. Doing okay? Yes. All right, now we're going to go into shoulder internal rotation and external rotation. So I'm going to support the humerus with my left hand, and I'm going to grab slightly on the wrist right here. We're going to do internal rotation and external rotation. Internal rotation and external rotation. All right, so the next motion I'm going to demonstrate is going to be elbow flexion and extension and some supination and pronation. So we're going to do elbow flexion first. I'm going to have the patient's arm straight down to the floor right against her side. And the active flexion is bringing the forearm up to the bicep. So we're going to start in anatomical position with the hand facing up or supinated. And we're going to go flexion and back down, flexion, back down, and then extension is going to be bringing the arm to all the way down. Extension, flexion, extension, flexion. Next we're going to do supination and pronation, and this is the forearm rotation. So I'm going to support her forearm with one hand, and we're going to start, we're already in supination, but we're going to turn her arm down to pronation. Pronation, supination, pronation, supination. Next we're going to do wrist flexion and extension. So I'm going to have her pronate her hand all the way down. I'm going to use my right hand to support her wrist and the other hand to support her forearm. And we're going to point the palm of the hand down towards the underside of the forearm. So we're going to do wrist flexion like you're showing a ring, and extension like you're telling someone to stop. wrist flexion and extension, flexion and extension. Once we're done with wrist flexion, when we have our hand already pronated in the same position with the hand, left hand under the forearm and the right hand supporting the wrist, we're going to do ulnar and radial deviation. So radial deviation is the act of moving the thumb, rotate on a horizontal axis, and we're going to rotate towards the forearm. So radial deviation, and then the ulnar deviation is pulling the pinky in a horizontal plane, and we're going to do ulnar deviation. Radial deviation, ulnar deviation. Next, we're going to do the passive range of motion of the hand and fingers. So we're going to start with the metacarpal phalanges, or the MCP flexion and extension. So I'm going to support her wrist with my non-dominant hand, and I'm going to move the fingers with my dominant hand. The first one is going to be MCP flexion. So making sure that there's no extension in the wrist, we're going to push down for flexion and pull the fingers up for extension. Down for flexion, up for extension. Next, we're going to move on to the proximal, which is this first knuckle. We're going to do the proximal intercarpal phalange flexion in each finger. So we're going to, in fingers 2 through 5, flexion, extension, flexion, extension, flexion, extension, flexion, extension, flexion, extension. And next we're going to move on to the distal inner phalange. Right at the tip, the first knuckle, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Next one we're going to do is the CMC, or the carpal metacarpal, and we're going to make sure that the forearm is in a neutral position, and we're going to do CMC abduction and then CMC adduction, abduction, adduction.